First of all, I'd like to thank the organization for inviting me. It's a pleasure and an honor. And then, yeah, I'm really the semiconductor guy in this panel, so I guess most of you are semiconductor guys, right? Isn't it fantastic to see the number of opportunities that these guys are unrolling in front of us? Of course, the challenge is going to be how to capture them, because technology is really only the bricks. And these guys need houses, so we need to build homes with those bricks. And that's going to be the topic of my presentation. Because Professor Kara only gave me 10 to 15 minutes, I said, well, how am I going to tackle the education and healthcare? I just need to focus. So I'll focus on healthcare. I'll just briefly discuss, very briefly, education. And this presentation is really about how to link technology, which is not a solution, it's an enabler, to link that to society. Because that's what we're talking about, is how to bring solutions to the last person, as Professor Kara was saying. And technology can play a very important role, but we need to use it wisely. So, let me see if I can get this to work. First, a few slides on education, and then we'll switch to healthcare. Education in India is well respected. You have a very good reputation when it comes to education. However, what's good can still be improved. And I think one way to still improve the education system is by its efficacy, by linking it more strongly to industry and to problems in society. And this morning we heard we don't have time to create fantastic academical engineers. They need to already start to think of problems they're going to solve while they're studying. So that's why, as an example, we are reaching out to institutes. We're setting up labs in the institutes. We're providing infrastructure. We're providing development kits, coaching, design challenges, to exactly nurture that link, that tie-up between the academic institute and the industry. So this is a top-down approach to improving what is already good in terms of education. Another one, which is more addressing the accessibility of education at the bottom of the pyramid, is what I've been told. You can understand, I'm not an Indian, but I've been told it's called the Jugaad approach, which really means what people have been talking about this morning. It's new processes to develop solutions that are durable, affordable, and mass deployable. It's the only way we're going to be able to deploy solutions to the last person. And with that, of course, also semiconductors can play a role, and we'll see the healthcare equivalent in a minute. So let's switch to healthcare. And let's first discuss a few trends. From those trends we'll derive, you can see I'm an engineer, right? From the trends we derive the requirements. We'll see how semiconductors can facilitate meeting those requirements, but there's something in between that needs to be solved and needs to be tackled. So one of the trends is, absolutely, I've heard it before, today you do have a system where the tertiary care is maybe 100, specialized hospitals, care centers, secondary care, there's thousands, and primary care, there's tens of thousands. Now what's happening today is that innovative healthcare solutions are still primarily deployed into the tertiary care centers. Obviously, it doesn't reach the masses. In order to reach the masses, the deployment of innovation needs to go to the primary care centers. One nice example is that of Narayana Hridayala's tele-treatment of cardiac pathologies. And it's clear, you know, you don't need to bring all these people to an operating theater. It's only 1% or even less that requires an operation. So if you don't need to operate, you don't need to touch. If you don't need to touch, you don't need to be there. As simple as that. So make sure you have a link that links people anywhere in the country to the expert at hand. And I understand that this center is treating over 30,000 patients and is already deploying technology to make this really reality. Another trend, an obvious trend is, hey, what's better to avoid problems and access problems than to go from treatment to prevention? Treatment is expensive. It is hard to access. It is very limited in its effectiveness. Most of the time, if you need treatment, it's already too late. You can solve part of the problem, but you cannot get rid of the problem. Much better is to go to prevention, which is inexpensive, it is preventive, and it's convenient. It can occur at the comfort of your home or your medical doctor's office. Another major trend, and again I like to use an example well known in India and in the rest of the world, is Dr. Arvind's eye care centers that treat glaucoma. And well, they do not treat anymore glaucoma. They try to very early on identify, and the earlier you identify it, the more effective the more easy the treatment is, and the more effective the treatment is. It's a very simple thing, but it's not always on the minds of people in the specialized hospitals. So now let's have a look. Those two trends, where are they driving us? What kind of functional requirements do they impose to future healthcare systems that have the ability to be deployed? So clearly, and it's been said many times, it needs to be affordable. Cost is a big inhibitor. So affordability. Second, it needs to be easy to use. You don't want to have experts, educated experts with every piece of equipment that you want to deploy in a mass market. Easy to use is human interface, needs to be taken care of, form factor needs to be appropriate. It needs to be connected, one way or another, whether it's wireless or wired, but the bloody thing needs to be connected to maybe a hub that then is connected to a specialized care center. It needs to be secure. Eventually, you want to make sure that the data belong to the patient and that there is no mismatch there.